course, welcoming the return of the Prime Minister after his recovery from COVID-19. It's good to see him back at Downing Street at a crucial time for the country as we battle against the spread of coronavirus and defend our health service, of course, from its worst ravages. And as we continue as a society to limit the progression of COVID-19, it is really important to remind ourselves of some of the key points which the Prime Minister has made. Boris Johnson said the country had shown a great collective resolve in suppressing the peak of COVID-19 by staying at home and easing the pressure on our hospitals, and that's certainly true in Northern Ireland. However, that collective effort is far from over. The Prime Minister stressed that we are still in a critical moment in the fight against COVID-19, and we are in the first wave of the pandemic, and that means we still face the real risk of the reproduction rate of this virus going back above 1. So now is not the time for government, for businesses and for individuals to gamble with people's lives, and we need to proceed cautiously and ensure that we are doing everything we can to prevent another spike from occurring. Having done a remarkable job in slowing COVID-19's advance, governments around the world are wrestling with the dilemma of when is the right time to lift the restrictions. And last Friday, the Executive agreed to the reopening of cemeteries on a restricted basis, and that decision was criteria-led and, of course, was based on scientific advice. The Executive will continue that approach in every decision we reach relating to COVID-19, but you also, the Greater Northern Ireland community, have a role to play. We are conscious that a lot has been asked of you, the public, in recent weeks, and it is understandable, having spent so much time shielding, social isolating or social distancing, that many of you want to get out of the confines of your home and interact with family and friends once more. However, now is not the time for impatience to get the better of us. No one should act as if coronavirus has been beaten. It hasn't, and we still have some way to go. If people go back to gathering in large numbers in public spaces, and if they do not listen to the guidance on social distancing, then they run the risk of another spike. Having come so far in containing this disease, it would be more than just a crying shame to undo that collective effort. It would be catastrophic for families, for communities, and for a society as small as Northern Ireland's. And as the Prime Minister said, while we start to think about relaxation, we have to guard against losing the control we have started to exert over the progression of this virus. We need to plot our path carefully to something resembling normalities, but if we go too fast and if people act as if the virus is beaten, then the UK Government and the devolved administrations will be forced again to slam on the brakes in this country and on the economy. That's not where we want to be, and we cannot afford to get too far ahead of ourselves. We all need to listen to the scientific advice, the restrictions which we can afford to relax, but we also need to listen to the scientific advice on when the right moment will be to do all of that. These are not easy decisions, and every government is wrestling with them. So we need you to give us the space to do our job based on medical advice, scientific advice, and we also need you to do your bit as well. Please act sensibly, please heed the scientific advice on containing the virus, and please remain at home as much as possible. If you need to go out for work, for shopping or exercise, please respect the social distancing advice and, of course, wash your hands thoroughly. Because the vast majority of you have helped save lives and boost our health services' ability to cope by following that advice. And together we have weathered some of the worst moments of the storm. We haven't reached the end. There is some way still to go. So please stay the course, please stay at home, and please save lives. Michelle.
Thanks, Arlene, and good afternoon, everybody. Can I just start by extending our thanks to Amanda and Christine, our sign language interpreters, for all the work that they do in helping us to communicate with those members of the deaf community. We're really grateful to you both, girls, for the work that you're doing to support us at this time. Sadly, today we have learned of a further 10 deaths as a result of COVID-19, and that brings the total number of deaths reported through our health trust to 309. And including those additional coronavirus-related deaths supported by NISRA, that means our total figure stands at 412 people that have lost their lives. Our thoughts are very much with all those who have lost and all of their loved ones. With each day that passes, we learn even more about the impacts of this disease and the devastation it is causing. So it's disappointing to hear reports from some people who seem to decided for themselves that it's time to relax the restrictions that are in place to save lives. Can I just say that kind of attitude is wrong, it's reckless, and it is endangering lives. Until a vaccine is found, it means that we must coexist with this virus. And that means a radical change to how we live our daily lives for some time. But for the most part, the vast majority of people have been making personal sacrifices for that greater good. And thank you for that. But we must keep going. We must save lives. There is light at the end of the tunnel. There certainly is light at the end of the tunnel. But we need to keep doing what we're doing now in order to save lives and to allow our healthcare staff to be able to cope in our healthcare system. It has been really heartening to see how people have rallied around and responded to the need out there among our communities. And of course, for our outstanding frontline workers who, in spite of the risk, go out day and daily to serve the public. All those working across health and social care who are working so hard to keep people safe and keep them well during this time. We have heard unbelievable stories of care home staff packing up and moving into the home to look after vulnerable residents to minimise the risk of transmitting the virus to them. What a selfless thing to do, to put your own needs aside for the good of others. We know that care homes are particularly vulnerable to coronavirus, and all those people working in them, whether they're staying or returning to their own families at the end of the day, don't just deserve our thanks and our praise, they deserve to be protected and they deserve our support. So I'm pleased that a range of further measures have been announced to support our care homes at this time. 6.5 million of additional funding will help bring in additional staff and support the isolation of residents where that's necessary. It will also help to ensure an increased level of cleaning, which is vital if we're going to minimise the spread of the virus. PPE for care at homes is also being prioritised, and further progress has been made on testing and will now be carried out on all staff and all residents in care homes when a potential outbreak is identified. As an executive, we will continue to do everything that we can to protect our people in the here and the now, and to make sure that they are supported into the future. We are working day in and day out and taking action to ensure our response is the right one for our people. We will meet again on Thursday with senior ministers in the South as part of our ongoing North-South engagement. And just to finish, just to repeat, please everyone stay at home and only go out if it's necessary. We have more work to do here to battle COVID-19, so continue to work with us and we will get to the point where we can give you light at the end of the tunnel. Thank you.
Good afternoon. First Ministers, you referenced at the start of your statement there, Arlene Foster, Boris Johnson, the comments that he made at Downing Street today, where it's very clear that there'll be no hasty relaxation of the lockdown. On UTV tonight, the virologist Conor Bamford is saying that relaxing the lockdown now would be dangerous and could have dire consequences. So despite pressure from business and concerns around the economy, do you both see a situation where the lockdown could or should be extended beyond May 7th? And the second part question, this time on contact tracing, you'll be aware the pilot scheme is underway in Northern Ireland. Do you believe that Northern Ireland has learned from the effective approach on testing already underway in the Republic?
Well, Tracy, thank you. And as I said in my opening comments, delighted to see the Prime Minister back in Downing Street, and absolutely agree with his comments today about the fact that we are at a moment of great risk, because whilst we can see the trend going in a particular direction, we are not out of the woods yet, and we're certainly not rushing to the exit door. We need to be able to take all of our decisions in the best informed way. And of course, we'll do that with colleagues across the United Kingdom, taking into account the scientific advice that we're given and indeed our own medical modelling that goes on here in Northern Ireland. I think it's very important to say that. So in terms of the restrictions, which of course will be reviewed up until I think it's the 9th of May, we will of course be wanting to take all of the best evidence and data that we have accumulated to make those decisions in as best a way as we possibly can. We are aware, of course, that it is hugely frustrating and these are draconian restrictions, but we're asking people to be patient and to bear with us because it is working, and we've seen that it has worked right across Northern Ireland, so it's important to do that. In terms of the contact tracing, very much the policy of the UK Government now is to test, track and to trace, and as part of that, as you know, the contact tracing pilot is starting here this week. We're also, the Department of Health is also looking at the development of the contact tracing app, which has been developed on the mainland, and we will be a part of that as well. So it is a good news in respect of testing, as Michelle has said. All staff and all residents and potential outbreaks in care homes, all of those people will now be tested. If you're coming in from a hospital into a care home, you will be tested. If you're coming in from your own home into a care home, you will be tested as well. So that is good news and good progress in relation to testing.
Also, can I wish Boris Johnson well today on his return to work, and to all those people out there that are actually recovering from coronavirus, because quite often what we talk about here every day is sadly those people that have lost their lives. But there are many really positive stories of people who have, come through coronavirus, and I think myself even about Niall Murphy, and that when I saw the images of him being coming out and actually standing on the street speaking to his mother, I just thought that was a powerful image that you actually can. Some people can come through this with the help of our health service. So I think it's important to reflect on that also. I welcome the step that the British government appear, albeit belatedly, but they appear to now be on the page of the World Health Organisation's position of test, trace and isolate. And we now have a plan in place here to get us to that point. And I think it's important that we get there as quickly as possible, because we all know that when you look to other examples elsewhere, other countries that have been through this, the countries that appear to be the most effective are the countries that have actually moved on this very, very quickly. So the contact tracing will be rolled out to start this week, and we need to see that rolled out right across the community, because that is part of our success in being able to counter the position that we could find ourselves in later, where if you were facing a second wave of this, that our ability to stop that actually will come down to how effective we are with the contact tracing. So we need to get there as quickly as possible, and learn examples from wherever we can learn those examples of best practice. And on the lockdown, again, our message is please keep doing what you're doing. And we do know it's difficult, and the sun was shining at the weekend and people were tempted to get together, but we really, really need people to not do that. Otherwise, we will have a situation where the progress that's been made will be reversed, and none of us want to go there. We don't want to reset. We don't want to go back to the start again. And we need to keep doing what we're doing, because we're actually being effective. And if people stay the course and actually keep doing what they're doing, then that reduces the number of people that will lose their lives, but it also helps our healthcare staff to be able to cope through this. We have to take whatever measures are necessary to help save lives, because that's what this is all about. And I think that we want to be able to give people hope that there is light at the end of the tunnel. I think it's important that people have that hope for the future, but we'll get there quicker if people keep doing what they're doing. Hi, Jane.
Afternoon. Hello,
Hi,
how are
Jane.
you? You'll have seen the comments by Mary Lou MacDonald in the Sunday Times over the weekend, saying that COVID-19 has proved to be a greater catalyst towards the United Ireland than Brexit, because it demonstrated the need for this one island approach to public health. I just wonder, is that your view as well, Deputy First Minister, and also to the First Minister? What do you make of the comments, given some of your colleagues have already criticised the remarks? And secondly, could I also ask Michelle O'Neill just to clarify, you mentioned that figure of 412 deaths in total. Could you just explain that a little bit? Because there's the discrepancy in numbers, and people are hearing numbers all the time. And so if you could give us a little bit more detail on that, that might be useful. Thank you.
Okay. Well, firstly, on the numbers, I was explaining the difference, because we have the Department of Health's figures which come from the trusts, but then we also have the NISRA figures. So I was joining up those two numbers to give people a fuller picture of actually the situation. So within the Health Trust, there's been 309 reported deaths, but the NISRA statistics, when you add that to it, it would bring it up to 412. So hopefully that clarifies that point, Jane. On the all-island, one-island approach to public health, it just makes sense. It's not a political point, it's actually just about good public health. I'm glad that we have a memorandum of understanding now in place which actually allows us to work together across this island to share our practices, to look at how we can procure together, to look at our all-island modelling. We live on an island, so we have a natural advantage which it's important that we use that till our advantage of the people who live on this island. So I just think it makes good sense to have an all-island approach to this, and certainly I welcome the fact that we are having regular engagement with colleagues across the island, our health ministers, our CMOs, ourselves. Even on Thursday we'll have another North-South meeting. I think that it's not even a political point, it's a point just of good common sense, and actually working together is really important to get us through this.
Thanks, Jane. I think the most important job for me as First Minister of Northern Ireland is to protect lives, to save lives, to make sure that our National Health Service, that great British institution, is not in any way overwhelmed by what is going on. And so I do think it is regrettable that other leaders are interested in constitutional navel-gazing at this time. I think it would be important for us to look back with hindsight when we're not in the middle of a pandemic, but for others their priorities lie elsewhere. I think that is regrettable. As I say, my most important job at the moment is to warn, to protect, and that's what I'm focused on doing.
First Minister, Deputy First Minister, you touched on it there earlier in regard to the anecdotal reports of complacency that potentially have set in the last few days. How can the executive respond to that if that continues? Would there need to be a potential to revisit the regulations and potentially beef up some of the punishments, or is there even scope for making implementing stricter restrictions than there are already? I mean, if that is possible, is that one of the ways the executive can potentially nip that in the bud, so to speak? And just secondly, you'll be aware that the Taoiseach in the Irish Republic is intending to publish his strategy, the blueprint for getting out of that, and how Ireland may exit in a sequential way as the months progress. Do you have plans to let the public know how Northern Ireland will emerge from this when it does?
Yeah, so to that second point, David, we had a very useful conversation today about planning for recovery and renewal, and we will look to engage with the public around that. But it's actually linked to your first point, which is how do we very clearly say to the public in Northern Ireland that they have to continue to keep social isolating, social distancing, and indeed to stay at home where possible. And that's why we want to be very clear when we come to this press conference, when we communicate with the Northern Ireland public. We're not here to entertain, we're here to warn, and we're here to protect the people of Northern Ireland, which is why we're giving out this very stark message that we are at a critical point, and that if you start to think that you can go out more often and that you can meet up with people, then you are not only putting yourself at risk, but putting wider Northern Ireland at risk. We are seeing the trend go in a particular direction. I very much welcome that. That's down to the people of Northern Ireland, but we need to keep doing it. And when we are able to relax those restrictions, we will do so.
Yeah, I think that the point about people, anecdotally, people being out and about more. I mean, there's more traffic on the roads, that's for sure, and people are perhaps relaxing. And I think Arlene's right. The two things are interlinked, because the more you talk about coming out and exit strategies, then that feeds into the public discourse where people think it's fine to start adapting their behaviour at a time whenever it's crucially important that people keep doing what they're doing, and they keep staying apart, and they keep staying at home, and they only go out where it's necessary under the regulations and the areas where it's been identified that they can go out. So we have to keep all these things under review, and we actually discussed this morning at the CCG, or just around, you know, that enforcement piece, the current regulations, what that looks like. But I can say, like, the vast majority of people are doing the right thing. Just some people are actually just maybe moving too far ahead of where we're actually at. People need to keep doing what they're doing, and as soon as we're able to speak about exiting and relaxing measures and all those things, then that's when we will do it. We're not going to, you know, keep this situation going for any longer than necessary, but we do have to try and save lives, and we all need to play our part in that. So please, again, to the public, keep staying at home.
Nigel Gould here, Downtown Radio, Cool FM. Look, just on the back of the last question there, do you think some people are now voting with their feet regarding the restrictions? And how concerned are you given the big messages you're already constantly putting out there? And also, First Minister, you told Cool FM last week that there could be a chance we could lift lockdown restrictions potentially ahead of the UK generally. Given Boris Johnson's insistence today that they weren't likely to change anything significantly anytime soon, do you still believe we could jump first? And if I could just ask a question to the Deputy First Minister as well, given these continued, as everyone has said, draconian restrictions, isn't there a huge challenge for the health service afterwards with a potential wave of mental health issues? Is this something you have considered? And are there any plans in place to address this once it's all over?
There's a lot in that, Nigel, and we'll try and get through some of those points that you've made. Look, I mean, in my interview with Cool FM last week, the point I was making wasn't that Northern Ireland would be the first to move. The point I was making is there may be differentials in when people might move across a country as large as the United Kingdom, because we've seen in Germany that different regions of Germany move at different times. Doesn't mean that we would be the first to move. It certainly doesn't mean that we might be the first to move, but I was making the point that in countries like South Korea and Germany, that different parts of the country have moved at different times, and we're not ruling that out in terms of the wider UK piece. And in terms of the messaging, we are saying very clearly to you that our role as leaders in Northern Ireland is to warn, is to try and protect, and it's to inform our citizens. And we have been given the information from our medical and scientific advisors. They are saying to us that we're at a critical point. If we keep on doing what we're doing, then we'll continue to flatten the curve. We'll continue to see less people going into hospital, less people going into ICU, and hopefully less people passing away. But if we relax those, and if people start to come out more, and if they start to integrate more, then there is a chance that we will see more hospital admissions coming in a couple of weeks' time. And we certainly don't want to see that happening, Nigel, and that's why we're being so straight today about the messaging, that it's so important to keep doing what we've been saying throughout all of our press conferences.
And you also raised the issue then, Nigel, of mental health, and we all have to mind each other right now. And because you're asking people to do such extreme things and, you know, step outside their normal comfort zones and all the rest, that you have to be mindful of everybody right now, and we all need to look out for other people as well. So whilst we're asking people to stay apart, we're certainly not asking them to not connect. We're asking people to stay connected as best as you can. Use whatever platform that you use, if it's, you know, social media or lifting the phone, and just making sure that you're staying connected with your family is really, really important. Right now, and also just to remind people that there are actually services that are still available to support people online, and if you need any support in that, get in touch with your local elected representative from whatever party they may come from. They all can signpost you to where you can actually get support. There's a number of like online mental wellbeing courses and things that are being promoted right now. So really, we're very mindful of this. I'm very glad at the executive last week that we agreed to appoint a mental health champion, which will probably be more for the more medium to longer term. But in the here and now, we all just need to look out for each other and try to mind each other as best we can. And also remember this, not everybody has family. Not everybody has somebody. So if you know anybody in your street or who's in that category, then I'd encourage you to reach out to them in whatever way, in a safe way that you can do that. But just to remind people that there are supports there for you right now, and it's okay not to be okay, and it's certainly okay to ask for help.
Thank you.
Thank you.